Okay, so today we're going to be doing functional movement screening, and this is really important for athletes as far as determining what muscular imbalances they have and areas of improvement that they can improve on with their performance and preventing injuries. So we're going to go through each of these tests and really just get a snapshot of how they can do these things, what it indicates, and then you can go back and grade them on how well they did, and then that helps you progress into the treatment, knowing what to attack and target to help them out. So first we're going to perform a deep squat. So I'm going to have Miss Cassidy here place the dowel rod over his head, and I'm going to have you just go ahead and perform a few squats, and I'm going to observe from the front, side, and back view. So go ahead and squat for me, normally. Not instructing them to do anything. This helps identify muscular imbalances, so go ahead and keep squatting until I tell you to stop. So we're looking at the base of their feet. Are their feet turned out? We're looking at their torso, how they're translating and moving through the motion. Core is very important. So looking at the side. A lot of times in female athletes, you're going to see that knee cave in. And this is really important to detect so they aren't prone to ACL injuries, which is a big thing among female athletes. Looking at the shoulder placement, which shoulder is high, so this shoulder is high here, you see. On her, you'd see that right shoulder probably be a little bit high. Again, not a bad squat. And again, this is a very good test to indicate a lot of muscular imbalances. All right, the next test we're going to do is the hurdle step test, and this is going to really test core and hip stability while doing a motion and seeing if there's any pelvic instability or limited mobility within that area. So what I'm going to have you do, Cass, is go ahead and step up to this band, and I'm going to measure to the patient's tibial tuberosity. Good. So I'm going to measure and place the band at that level. And then I'm going to have the patient, you can scoot back to a comfortable distance if that's okay there. I might scoot up a little bit. Having them place the dowel rod resting on their shoulders. And Cass, I'm going to have you go ahead and do 3 warm-ups. So basically the movement is I want you to lift that leg, come up and over the band, and touch your heel to the ground. And if you need to scoot forward a little bit, there, get a comfortable distance. Tapping the ground, and then coming back up. So 3 that way. Kind of getting a feel, letting them warm up a little bit. We're going to do both sides, so go ahead and do a few on that other side. And we don't want them to hit the band at all. All right, so now what I'm going to have you do on the real 3 reps, I'm going to have you look forward and do the same thing left and right side. So when you're ready, I'm observing, can they keep their balance? Are they swaying? Is he touching the ground with his heel? Is he touching the band? So doing a really good job. Let's switch into the other side, looking forward, good. Noticing the feet, ankle stability. It's really important in volleyball players that they have good ankle stability when jumping. So pretty good job, I think it passes. All right, the next test we're gonna do is the inline lunge. So first we wanna make sure that the patient or the athlete is keeping a neutral spine. This is important when lifting. So to monitor that while we do this motion, I'm going to have Cass put the dowel rod vertical, touching 3 points of contact. Go ahead and turn to the side so we can visualize this. Touching the head, mid-back, and sacrum. All right? So then he's going to hold that in place, and then go ahead and come here. Then we're going to measure the patient's tibial tuberosity to the ground, and this is going to be our distance that we want them to be able to lunge toward and get to that position. So again, keeping those points of contact, Cass, I want you to lunge forward as far as you can. Seeing if we lose any points of contact, making sure that spine is neutral, good core stability. Is he leaning one way? Knees touching the ground, that's very good. We're going to do both sides. Good, he's reaching the distance, which is a good indication. Good. So overall, again, doing a motion, checking core stability. Through that motion, do you have good stability through the hips and the core? And he demonstrates that very well in this video. All right, the next test we're going to do is shoulder mobility reaching, and this is really important for overhead athletes as far as their range of motion and mobility and addressing where they're having deficits. So what we're gonna do with this test, we're first gonna measure your athlete's hand length. So I'm gonna have Cass go from the base here all the way here, so about 6.5 inches there. And that's gonna be our measurement to see if he's getting adequate internal and external rotation of his shoulders. So with this patient having a right shoulder issue, and even throwing athletes, volleyball players that are right-handed, they have really increased external rotation, but they lack on their internal rotation. So this test is a really good indicator, will highlight those two things most likely. So I'm gonna have Cass make a fist with both hands. I'm gonna have you reach your shoulder up, like you're scratching your back, and go as far as you can here. And then reach this one back, up underneath. Ooh. All right, so then we take our measurement. Obviously this is well over 6.5 inches. So we're gonna switch and evaluate the other side and see which one is worse. So go ahead and switch. So both pretty limited here. So go ahead and relax. So with shoulder mobility issues, we always want to look in the thoracic area as well, because thoracic mobility plays into our shoulder and scapular stability. So this is a really good test as far as working on your internal rotators, most likely for these throwing athletes. And for him, we could use some work in both those areas. All right, the next test we're going to do is an active straight leg test. And this is going to, test the flexibility of the hamstrings. It's also going to test core and pelvic control of keeping that opposite hip down while we lift one leg. So you're going to have the patient lay face up, placing this underneath the patient's knees. It's got Velcro, so it's not. There we go. All right, then you're going to take a dowel rod and measure from the ASIS halfway between the box here and the ASIS, and this is your point to which you want them to raise their leg to, and see if they can raise it. So, Cass, what I have you do is bring your right leg, keep it straight, keep this hip on the ground, and lift it as far up as you can. Good. So we'll do a couple of those. Good, and a good test is to have them do a few and then activate their core and do it and see if it improves, and see if it's more of a core or hamstring issue. So let's go do it on the other side. So observing the height at which they're lifting the leg, keeping that hip on the ground. Cass is doing well. Our volleyball patient, she's very hypermobile, so this probably isn't going to be a difficult test for her to do. And so we would see good hamstring length and flexibility there. So that is the straight leg active test. All right, the next test we're going to do is a trunk stability push-up. And this is really going to test the athlete's ability to keep a neutral spine while stabilizing their core, upper body, and lower body all at once. So I'm going to have the patient. So for a guy and a girl, this is going to vary. For a male athlete, you're going to have the thumbs at the level of the forehead when attempting this movement. For females, you're going to have them at the top of the chin. Their thumbs at the top of the chin. So let's go ahead. We'll do the female position. And Cass, when you're ready, go ahead and do a push-up, and we'll do 3. Observing the spine. Do they cave in the lumbars? Are they rounding? Are they able to do those 3 sets? If not, then you progress lower, and you can go back and grade it based on the level of which they can perform the test. All right, the last test we're going to do is a rotary stability test, and this is really a good core test mixed with combining complex movements for these athletes. So this is a more complicated test. So you're going to have your athlete get into all fours here, making sure everything's at 90 degrees, good stability, good base. The knees are shoulder width apart. That's really good. Go ahead, just right there. Then what you're going to have the patient do is extend the left arm with the left leg at the same time. So let's see if Cass can perform that movement. Good.
Nope.
Struggling a little bit. Let's try the other side. So you see he's really shifting his weight, leaning on that right side. Right side's a little bit better. Again, okay. So if a patient, go ahead and relax. If if a patient has difficulty doing that or can't do that at all, then we're gonna progress down to the next level, which is a bird dog, opposite pattern direction. So left arm, right leg, are they keeping a neutral spine? This is way better. As far as for him, let's go ahead and do the opposite side. We'll perform 3 reps on each one. Again, testing trunk stability with complex arm movement.